Wait a minute.
I messed up. Hello, I'm Rachel Ellis. I'm your nursing student today. May I check your ID badge? Your ID band, please? And can you please state your name and date of birth for me?
Yes, my name is Shirley Gibbons. My birthday's May 5th, 1964.
Okay, thank you very much. And also, can you tell me if you're allergic to any meds or other substances?
Yes, I'm allergic to latex, codeine, and sulfa.
Okay, that's good. So what I'm here for is to give you your insulin, and so that will not be contraindicated with your allergies. So your blood sugar a few minutes ago was 230, and so that's a little bit high. That's made you just a little bit too sweet. So anyway, we're here to give you your insulin that the physician has ordered, and let me check your orders real quick. Okay, and it says you are to get NPH insulin 15 units and regular insulin 5 units sub-Q. Okay, 15. Okay, that's a total of 20. So let me pull you up on my computer, and let me also scan your ID band as well so we can get you in the computer. Okay, gotcha. And I see here, on here, the orders as well. And so we're going to get your insulin out of the med cart, the med drawer. And I'm gonna be giving it to you with your insulin syringe, and as you know, and you probably already know this, but when we give insulin, we only give it with an insulin syringe, and it looks like this. It's orange, and it'll have either U100 or U50 on it, but this is the only type syringe you wanna use to give insulin. And I'm gonna draw it up right quick. Okay, and get some gloves on. All right, let's see, your NPH, yes, and it's not expired. And your regular insulin, and it's not expired either. And so what I'm gonna do now, I don't know if you can, let me see if you can see what I'm doing here. I'm gonna wipe both vials with the alcohol prep to make sure they're as clean as can be. And then what I'm gonna do is show you how we mix the insulin, okay? Let me get on some gloves.
So can I ask you a question?
Yes.
How long is the insulin good for if the cap has been removed?
It's actually good for 28 to 30 days. And when you remove the cap, that's how long it's good for. And you also need to keep it in a cool place at home. If you don't have air conditioning at home, you need to keep it in the refrigerator and then let it warm a little bit before you give it. But so you'll have two, it comes with an expiration date that's a longer shelf life, but once you open it, it's only good for 38 days. I mean, not 38 days, 28 days to 30, okay?
Okay, thank you.
All right, so what I'm gonna do now is I'm gonna sit my top of my syringe down, and by the way, always use a new syringe and needle each time you give it. Okay, so now what we're gonna do here is we're going to pull up the equal amount of air. Oh, first of all, I'm gonna roll my NPH because it needs to be cloudy. It's supposed to be cloudy with a white color. Do not shake it or you'll destroy it. And your regular is a clear substance, so you don't have to roll that. And then also, okay, so these are vials, and so the reason why we have to add air to them is so that we'll be able to continue to get the medicine out. If you don't add the equal amount of air for the amount of medicine you're removing, then it will lock the medicine in there and you won't be able to get it out. So what we're giving here is, we're gonna give 15 units of NPH. So I'm drawing up 15 on here, and by the way, this is your little needle guard. You can move it around so you can see. And let me find the 15. That's kind of side to side here on this syringe. There's the 15, okay? And I'm gonna put in air here into the NPH and take it out. Take the needle and syringe out, and then I'm gonna pull up the 5 units of air. And once again, I'm looking at it on here. You have to kind of turn it side to side, and I can move this guard around out of my way. And we're gonna put some air in the regular insulin. And then, once I put the air in, I'm gonna turn the vial up, and I'm gonna pull out 5 units of regular. Make sure when you're withdrawing the medicine, that your needle, the bevel of your needle, which is that little hole in the end, is in the medication itself. And make sure you keep the vial vertical with the syringe, because if not, you'll bend your needle, and we don't want to do that. So I'm going to pull out just a little extra. I'm going to get all the bubbles out, so I'll have an accurate dose. Dump these bubbles out and get my 5. And I want the top rim of the plunger, not the bottom rim. There's 2 rims. I want the top rim right on that line where it says 5, on that heavy line there, because they're in 5 unit increments. And by the way, your insulin is measured in units only. Okay, and there's my 5. And then now, since I've already placed air in my NPH, I don't have to place more. So I'm going to put my needle in here, in the NPH. And then I'm going to turn it up, and I'm going to pull out, withdraw 15 more units, which will give me a total of 20, being careful not to inject anything back in this vial, because we're mixing them. And this is how you mix your 2 types of insulin. And I've got 20. And can I get another nurse to come check this with me and make sure it's correct, please? Insulin needs to be checked by 2 people to make sure you have it right. We do that in the hospital all the time.
Yes, ma'am, can I help you?
Yes, can you verify with me the insulin?
I see 20 units.
Okay.
So what's the order?
15 of NPH and 5 of regular.
I agree.
Okay, thank you, ma'am.
You're welcome.
Now, since this hasn't been used and I need to prep you a little bit, I'm going to recap this needle one-handed. And this particular one, it sits flat up here, so you want to put it in until it clicks. Always recap it one-handed so you don't accidentally stick yourself, okay? And once I give you the injection, we never recap a used needle. Remember that. Okay. So with insulin, there's several, we're giving it subcutaneous, and that's how it's ordered, and that's what we're going to give this today. And there's several sites that we can give it, but the most common sites is can be behind your arm in the triceps area, not in the muscle, but in the little fatty portion of behind the upper arm, and we can go in either arm in your case. The other site is going to be on the abdomen. We're going to find the umbilicus, and we're going to go 2 inches out from the umbilicus and kind of make a circle around it, and we're going to give the insulin in outside that 2-inch radius, okay, and then kind of in the fatty part. All right, and then the third spot for insulin injection is in the outer aspect of your thigh. You can go for anywhere between the top of the knee and the femoral area, and go in the outer aspect. Excuse me, can't talk today. Need some more coffee. Okay, so anyway, and you can give it here as well within this area. Okay, a little bit different from I am. And when we give this at a 45 to 90 degree angle, depending on how big the sub-Q area is that we're injecting the medicine. Like typically for you, in the back of your arm would be a 45 degree. In the leg or the abdomen could be 90, because you got a good sized leg and a good sized abdomen. So where would you like your insulin? And by the way, we have to rotate our sites because we don't want to do damage to the tissue, since you're going to be getting this every day. So, okay, you want it in the abdomen? Okay. Well, no, let's go. You want it in the back of the arm. I understand, because you've been giving it in your abdomen at home. So we'll do it in the back of your arm at a 45 degree angle. All right, so since we don't really stick the mannequins, we're going to stick this pad. I'm going to scrub it real good and let the site dry. And then I'm going to take this off because I'm done with that. And then for sub-Q, I'm going to pinch up the site, and I'm going to give it in the back of the arm facing up toward the head that way at a 45 degree angle. This would be 90, and this is 45. So we're going to do it like this. It's going to be a little stick, and I'm pinching up, stick, and don't aspirate, don't pull back on this plunger. Just give the medicine steady, then out, and then if there's anything there, you can just dab it, but don't put pressure on it, okay? Now, once you're done with your needle, don't recap it. You've got this needle guard here, and you're going to push that up till it clicks. This one doesn't want to click. It's not behaving. So anyway, it's up till it clicks. And then we're going to place it in the sharps container. Okay? How are you feeling?
I'm okay, but I have a question.
Oh, yeah.
How soon will this insulin start to work?
Oh, yeah, it'll work. Both of these have 2 different onset, peak, and duration times. The regular is a little bit quicker acting, and it'll begin to act in 30 minutes, 30 to 60 minutes. And the duration of the regular is 2 to 4 hours, and then the duration is 5 to 8 hours. NPH is a little bit longer acting. It's called intermediate acting, and it doesn't, the onset on it is 1 to 2 hours, and the peak is 8 to 12, and the duration is anywhere from 12 to 24, depending on your metabolism and how high your blood sugar is. So what that regular insulin's gonna do now is cover for this meal, and by the way, we've got your meal right here. I'm gonna open up your tray for you so you can eat, because we wanna make sure you're eating if we give you insulin. And then, and that way, that regular is gonna give you coverage and help lower your blood sugar now for when you get ready to eat. Now, the NPH should give you coverage and keep your blood sugar at a normal or near normal level for the full day, okay? Any other questions?
No, thank you.
You're welcome.